This is The Rounds Table.
Welcome back, Rounds Table listeners. This is John Fralick, one of your hosts. Today, we're going to do a solo episode, and this one is looking at a paper published in the New England Journal, May 2025, called Sotatercept in Patients with Pulmonary Arterial Hypertension at High Risk for Death. This was by Humbert et al. So what was the research question here? Well, they wanted to know what is the effect of Sotatercept in patients with advanced pulmonary arterial hypertension who are at high risk for death. Why is this important? PAH is a progressive, sometimes fatal disease caused by remodeling of pulmonary vasculature, ultimately leading to right ventricular failure. Without getting into the pathophysiology too much, activins have been found to contribute to pulmonary vascular remodeling, and Sotatercept is a first-in-class activin signaling inhibitor. A phase 3 clinical trial called Stellar had shown that for those with pulmonary arterial hypertension, the addition of Sotatercept led to improved functional outcomes, including 6-minute walk tests, and also reduced the risk of clinical worsening events by 84%. This trial, called the Zenith trial, looked at the impacts of Sotatercept on major outcomes in patients with more advanced pulmonary arterial hypertension who are already receiving maximum tolerated doses of double or triple therapy for PAH. So what was the design here? Well, this was a phase 3 multi-center, double-blind, randomized, placebo-controlled, industry-funded trial. For the patient population, these were adults aged 18 to 75 with symptomatic pulmonary arterial hypertension. It included those with idiopathic disease or those with secondary disease, including from heritable causes, drug or toxin-induced, connective tissue disease associated, or with simple congenital systemic to pulmonary shunts. Patients had to be a WHO functional class 3 or 4 and had to have a REVEAL Light 2 risk score of 9 or higher. For the WHO functional class, 3 indicates marked limitation with less than ordinary activity, and 4 indicates severe limitation with any activity. For the REVEAL score, the higher the number, the increased risk of death at 1 year. There were a number of exclusion criteria, including if you had PAH associated with portal hypertension, HIV, pulmonary veno-occlusive disease, or pulmonary capillary hemangiomatosis. If you had pulmonary hypertension from a non-group 1 cause, that was also excluded. If your LV was less than 45%, you were excluded. And if you had significant mitral or aortic valve disease, or if you had polycythemia or thrombocytopenia. So for the intervention, patients were randomized 1-to-1 to receive add-on subcutaneous Sotatercept at escalating doses or placebo every 21 days. This was in addition to max tolerated doses of double or triple therapy for PAH. When it comes to the outcomes, the primary outcome was a composite of death from any cause, lung transplantation, or hospitalization lasting at least 24 hours for worsening pulmonary arterial hypertension. There were also a number of secondary outcomes. Outcome adjudication was done by an independent committee who were blinded to treatment assignment. This was an intention to treat analysis. So what did the patients look like? Patients were recruited from December 2021 to July 2024. 255 patients were assessed, and ultimately 32% were excluded. The primary reason for exclusion was not having a REVEAL Light 2 score of 9 or higher and not meeting hemodynamic criteria. Ultimately, 172 patients were randomized. Median follow-up was 10.6 months in the Sotatercept group and 7.1 months in the placebo group. There were more women in the placebo group at 82% versus 71%, and those randomized to Sotatercept were less likely to have a BMI over 30. Otherwise, the average age was 54, 86% of patients were white, most had PAH for about 7.7 years, and the majority of 50% had idiopathic disease. 74% had a WHO functional class of 3, and 25% had a functional class of 4. So what were the main findings? Well, the trial had to be stopped early after a pre-planned interim analysis. The primary efficacy outcome, as a reminder, was a composite of death from any cause, lung transplantation, or hospitalization of at least 24 hours. This happened in 17.4% of those getting Sotatercept, compared with 54.7% of those in the placebo group. This corresponded to a hazard ratio of 0.24 with confidence intervals ranging from 0.13 to 0.43. That's just over a 37% absolute reduction. Now, this was largely driven by hospitalization events. One of the key secondary outcomes was overall survival, and Sotatercept was associated with better overall survival with a hazard ratio of 0.42, but confidence intervals overlapped 1 and ranged from 0.17 to 1.07. Looking at adverse events, bleeding complications were more common for those getting Sotatercept, with higher rates of epistaxis and gingival bleeding. Patients also had increased hemoglobin levels, higher risk for telangiectasia, and increased risk for thrombocytopenia. So what are some of the limitations here? Well, I guess it was a smaller sample size, but again, a fairly rare disease, all things considered. As well, early termination impacted longer-term assessment of safety and efficacy. This was also a composite outcome, and it was really driven by hospitalization as opposed to a clear reduction in death and risk for transplantation. But personally, I do think hospitalization is a pretty important outcome, both from a patient perspective, but also a healthcare utilization perspective. But speaking about healthcare utilization, what I'm unsure of is the economic impact here. Apparently, this drug costs upward of $240,000 per year. So what's the take-home point? Sotatercept was associated with a reduced risk of the composite outcome of death, lung transplantation, and hospitalizations in patients with pulmonary arterial hypertension, though this outcome was really driven by hospitalization. Is it practice changing? I guess it could be, but I think it's really going to come down to cost. Well, before we go, the good stuff. It's that time of year again for spelling bees, and the Scripps National Spelling Bee just recently happened. It's always entertaining to watch and listen to these. The winner was a 13-year-old guy from Texas. The winning word, éclaircissement. What does that word mean? I don't know. I had to look it up. Well, it's the clearing up of something obscure. I have no idea how you spell it, but that's one of the many reasons why I did not win the spelling bee. That's it for this week. Thanks a lot for listening. Talk to you guys later. The Rounds Table is hosted online at medicinepods.com, your one-stop source for comprehensive internal medicine education and evidence-based medicine resources. We can also be found on all of your favorite streaming services. You can also follow us on Instagram, LinkedIn, and X.